Good morning. This is Faith in Our Hometown, brought to you as a community service and sponsored by Mercy Hospital, Joplin. And now, here's your host, Father Jay Friedel.
Good morning, and thanks for joining us for another Sunday morning here on Faith in Our Hometown. You know, many times often affect our larger community, and one of the things that all of our health organizations in the area try to do is to try to figure out what are the assessments or what are the needs of the larger community. And we've been working on some of those during this past year, and this morning we're going to talk about one of those needs that was assessed that we try to make a difference in, and that's in cancer awareness, cancer screening, cancer health. Trying to keep us healthy, fortified against, trying perhaps to get cancers. So we're going to be right back with our guest, Dr. Kenneth Watts, who's a doctor at Mercy, and we're going to be right back after this Mercy Minute. Stay tuned, and we're going to talk about cancer health this morning.
I was in shock, and in denial, and I couldn't believe it was me. I was healthy, feeling well, but unbeknownst to me, after the colonoscopy, I found out that I had colon cancer. My name's Mario Guerrero. I'm an ethicist. I help people that are in a hospital and the medical staff process some of the difficult situations. In this case, it was the other way around.
Well, I'm glad they caught it earlier.
On my 50th birthday, I had a regular checkup. I wasn't concerned because I felt well. No family history of this type of cancer, and yet I developed this type of cancer. During the process of the colonoscopy, they were able to remove that polyp. And having that done within the hospital setting, they can just address all the issues right there and then. I'm a great believer in early detection. This is such a silent disease, and you really don't necessarily have symptoms. Go get checked. Follow up with your physician. Don't wait.
Well, thanks for joining us and being with us for another Sunday morning. This is Dr. Kenneth Watts, and so Dr. Watts, why don't you introduce yourself real fast and just tell us what you do and why you're here today.
Yeah, I'm one of the general surgeons at Mercy Clinic. I'm the medical director of our breast center, and that's kind of what I'm here today is to talk about our breast center.
Great. Well, in terms of it, I use kind of what I was laughing at during the break with you about. You say cancer health is kind of an oxymoron. It was kind of a strange way to say that. But you said, obviously, if you screen for it, you don't find any. That is cancer health,
that's right.
Which I think is a great thing. So what is kind of the status of that in our community? How do we help people to stay healthy, especially in terms of, we're talking this morning in some ways about breast cancer specifically, although it kind of flows out from there about other kinds of cancer. But let's talk specifically about breast cancer.
Well, the most important thing is just screening, at proper age, working with your primary care doctor to make for sure that it is time. We're still recommending women at the age of 40, unless they have other encounters like a high-risk family history of breast cancer, but still the average age of 40. We're very fortunate in this community through Mercy that we have mobile mammogram units that travel in Columbus, Baxter, and some other towns for folks that have a hard time getting in to screening. The most important thing about screening is that you do not have to have a doctor's order. You can just show up to our breast center and say you're here and need a mammogram, and if you're of the proper age, you will get a mammogram.
Yeah, and I think it's also important when we start talking about this community benefit, and those kinds of things, that all of the health, providers in our area, not just Mercy, but Freeman and everybody else, everybody got together and decided this, not just Mercy, but all the health providers in the area and the public health people and everything else. So again, if your providers are not Mercy or whatever, and you have to use a different, organization or whatever, please do that anyway. But you're saying 40 is definitely the age.
Yes,
as
long as you don't have other risk factors, but we're still recommending, that's kind of the national guidelines of 40 years.
So that's just kind of like that's if you're healthy and don't know that there's
40
anything
years
wrong.
of old, you should get a mammogram.
40 years old. Okay, yeah.
And just like you said about your insurance, I know Mercy will look at it to make for sure it is approved before you can have your mammogram, if that's any of question, because that's something that can be handled in the breast center also.
Yeah. So in terms of that, what other great like target things should our viewers be paying attention to in terms of? So we know 40 is one of those ages where if you've never had one done before or whatever, you need to start having them done then.
Well, and the benefit that we're very fortunate in this town is through Mercy's Breast Center is we have all the equipment just like any major city, Kansas City, St. Louis, where I trained at down at MD Anderson in Houston, all the same equipment. We have the 3D mammogram, which is the newest mammogram program to look at the breast in a 3D way to be able to find smaller masses. We also, of course, have breast ultrasound. We also have automated breast ultrasound, which is very important. That's the only one in this area, is in Mercy Hospital, and the benefit about that is that that's for women with higher densities. We know women that have higher densities, sometimes the cancer can be hidden, and that's one of the tools with the what we call ABUS, or automated breast ultrasound, that we can do for a second type screening to be able to find cancers that are even smaller. And then of course we have breast MRI, and that's usually for our higher risk population, or women that unfortunately have already been diagnosed with breast cancer, to use as a modality for help staging surgery and treatment.
Okay, so you know, like you say, all bodies are not built the same. So that's part of the reason why, you know, with different body types and things like that, as you say, a higher density. I guess it's higher density in the breast tissue.
In the breast tissue, yes,
right.
Because it makes the pictures have a little bit more white in them, and so that way it can kind of hide a smaller cancer.
Okay, and so you've got some equipment now that's a little bit. I mean, we keep refining equipment, obviously, through the through the years, and this is one of the refinements that's been made, is so that you can actually detect something that might have been hidden a few years ago.
Yes, and like I said, we're very fortunate in our breast center to have that equipment.
Cool. And so, you know, so screening at 40 would be one thing. What else can folks do to be taking care of themselves to, you know, kind of look out for things? I mean, are you getting any smarter? Are we getting any smarter about trying to say, okay, well, what do we think are some of the conditions that help cause this?
I wish, because then we could really get rid of it.
Okay, yeah.
You know, unfortunately for ladies, when they're born, they have a 1 in 8 chance of getting breast cancer.
Wow.
It's very, very high. It's super high. And, you know, like I tell folks, is that screening's not going to prevent it, but if we find it, we're going to find it early, and it's going to be curable. Yeah. You know, I always kind of make the joke, when my wife turned 40, what did I get her? I got her a mammogram for her birthday, because it's very, very important. And I see a lot of women with breast cancer, and because, like I said, it's a large amount of our population. There's very few women, or even men, that have not been with somebody in their family, a friend, or someone that they come in contact that's had to do with breast cancer.
Now, after the show, I'm going to coach you up on the gifts and everything, because I think it's a great loving gesture.
Yeah.
We need to do something else in addition to that.
Well,
So
I just want to know.
Your wife is watching.
Right. I just want to know. I want to keep her around for a long time.
That's a good thing.
That's
a good thing.
You know, the other thing that you know, a lot of folks coming in from Joplin, you know, our breast center, we're very fortunate that Mercy has put in the resources, and the strive for excellence is in their system. You know, we've recently just went through what's called national programs of accreditation for breast cancer, and that's the gold standard. What that means is that it doesn't matter if you're in Joplin, Missouri, or you're at Mayo Clinic, or you're at MD Anderson. All the care that you're going to get in this town is exactly identical, no changes. And that's through our Commission on Cancer, through our main cancer center, which is through the American College of Surgeons. And why that's so important is that I have to be just as good as a surgeon. Our oncologists have to be just as good as an oncologist, our radiation oncologists, our nurse navigators. I mean, it goes on about how we have to strive for excellence, just like anybody else in the country. And we're the only one in the region. And I think that's an important thing, because we have a standardization of care, and cancer care is much more than just the cancer itself. It's the psychosocial part of it. It's the physical therapy part of it. You know, it's the same way when a lady is undergoing a biopsy. We tell them in 48 hours we're going to give you an answer, bad or good. But then when that answer comes, it comes from a physician within 48 hours, no charge to the patient for that discussion. And then they're immediately brought in our breast navigator that helps them navigate through surgical appointments, CAT scan appointments, or lab appointments, or whatever else is there.
Whatever's indicated
That's
for
right.
them to do.
And the social part of it through our cancer center with our social workers and all that's just a big part, because like I said, it's not just diagnosis and treatment. There's much more that goes into cancer care than just that.
Well, and again, I think that's you know, certainly the desire on most people in the medical field to take care of the whole person. You know, I guess you could just take care of what you see as the tumor, or the lump, or whatever. But that whole person is really what needs the care.
And one of the big spiritual.
Oh yeah,
forgot to
well,
mention that.
I would have brought that up if you did not eventually get there. But yeah,
That's right.
But I mean, that's one of those things that we've always said. Is it working together on the whole person?
Yes.
We got to work not just on the physical person, but on the emotional part of them, the spiritual part of them.
And usually before the patients even start their therapies, we have our cancer group that meets every Tuesday in our tumor board, and we discuss all patients with a radiation oncologist, radiologists, surgeons, medical oncologists, physical therapists, social worker, our nurse navigators, and our nurses that are in charge of our cancer units, and also our research. We're very fortunate, since we do have a center of excellence, we're able to be involved in a lot more of the research protocols, so that way we are driving care for the future, not just taking care of what's now, but actually looking at it and driving it and improving it for hopefully the next generation.
Well, and I think that's if we stop learning, we're in trouble.
Absolutely.
Because something that we absolutely convinced is the answer at this particular point in time, we find out later, well, that wasn't what we should have been doing, and if you don't adjust, you're in big trouble.
That's right.
Yeah. In terms of helping people, in terms of that walking through that whole process, I'm glad that you've got a whole team. And to hear about that team is, I think, very important. What in your own experience, how do you, as the doctor in that lead thing, what do you, what's your particular area that you have to take care of in that whole thing while working with this team?
I take care of the surgical needs.
Okay, so you're the one that does the removal or those kinds of
removal of the
things.
tumor, doing in breast care, of course, breast conservation, meaning just removing the lump itself, or of course mastectomy, removing the breast. We're very fortunate to have a very skilled plastic surgeon at Mercy, Dr. Gray, and he helps doing the reconstruction, because it's not just, kind of what I say about, we're not giving what God gave you, but we're sure trying to do the best we can, when we reconstruct the breast. And a lot of it's more than just, a lot of women, especially older women, will tell me, oh, I don't need them, I'm done with them. Whoa, the good Lord gave you them for a reason. Yeah. Clothes fit better, you're more comfortable, and all that. And so there's not an age cutoff for that, and that discussion is always very open. But also getting them through their journey. I always tell them, I wish I could fast forward you 6 months. To get them through the pain from recovery, them getting over what they just heard as being told they have cancer, and get them to the other side when they no longer like their port that they get with their medicine, that I get to take that out. That's actually a joyous time because of the fact they don't need it anymore. Yeah. And so all that's very rewarding, going through that journey with those ladies. Yeah.
And I'm sure that you've got plenty of both tearful stories and plenty of joyful ones.
Well, as I can tell them every time, I'll take a hug every day.
There you go.
And because that's actually a joyous part of my job.
Sure.
Getting a hug. Yeah. But yeah, there's a lot of tears, but that's some of the joy when we're 2, 3, 4 years down the road, and talking about it. Yeah.
Sure. Well, our guest this morning is Dr. Kenneth Watts, who is a surgeon at Mercy, working with their breast cancer unit in terms of how do we, help people who wind up in this situation. And I'm sure that many of you know many of those folks who've been through similar situations and might know someone again, because 1 in 8 that's pretty high statistics. Yes. We're here this morning. This is Faith in Our Hometown. We're going to take a real short break, and then we're going to be right back to continue our conversation.
You're watching Faith in Our Hometown on KSN TV, brought to you as a community service and sponsored by Mercy Hospital, Joplin.
Well, again, thanks for staying with us this morning for our conversation on breast cancer and how we work on trying to improve that aspect of health here in our community. My guest this morning, again, Dr. Kenneth Watts from over at Mercy in that unit. And so, Dr. Watts, I mean, one of the things I think that sometimes our readers our viewers are gonna ask would be, how do we in the community here support our friends that we know that are going through these kinds of things? What would be the best advice you'd give to folks who are walking with somebody who's making this journey?
Yeah, try not to guide them with your opinion, but just encourage, and if sometimes maybe they just need a meal cooked, or maybe they just need their house cleaned, but just show more support. Than critiquing. I always joke, now everybody gets on the internet or Googles everything, and there's a lot of physicians on Google Internet, or so they think. But I always tell them that, read it with a grain of salt, but then talk to your doctor, and talk to them about what you've seen, or why something's not, why you don't think they had that discussion, so that way they can discuss that with you. And I actually tell my patients, whatever website you're looking at, please bring that web address in so I can look at it myself, and then I can be more than happy to discuss why we didn't talk about that, or why you're not a candidate for it, or if you are.
Yeah, and again, I think that's a really critical point. I do think with lots of information out there, it's a good thing, but it can also sometimes trip people up because they don't understand all the indicators that might, say, well, here's why, we didn't do this for you, or why we didn't take this particular thing, because there's no one size that fits everybody or everything.
Well, and that's exactly correct, because all women are different. That's why we're individuals. So everybody's breast cancer are individualized to that patient. So what your aunt might have received or grandma might have received 20 years ago, it's different now. And we're moving pretty quick with our therapies and the way things are changed. Even since I've been out of training 12 years ago, things have changed immensely, and that's for good. It's for a good thing, and I hope over the next 10 years it changes even more.
Sure.
And I hope that we're having ladies living a lot longer. They get diagnosed, and I hope no one gets diagnosed with advanced disease. And we talked about screening earlier, is that it doesn't prevent it, but if we catch it, we can catch it early, and that's what's so important.
Right.
I have a lot of ladies that say, oh, everything's been fine, and they haven't got mammograms in 2, 3, 4 years. Even my own mother that was diagnosed with breast cancer, she kept saying, oh, they're always normal, so she skipped them for a few years. And then she gets one, and guess what? She has a little mass, and then she had breast cancer. And so, it's important. We don't drive our cars until the wheels fall off. We maintain them, so we should maintain us.
Yeah. Well, I was kind of shocked. One of my friends several months ago had gone for a test, and there were some abnormal spots, and and they just said, well, we want to do another test just to be sure, and those kinds of things. And I was laughing, and I said to her, I said, well, you had that again a few years ago, and she said, I did? And I said, well, I thought that's what you told me. And she thought about it, and she called back a couple days later, and she said to me, she goes, I remember that now. She said, oh my gosh, she said, I relaxed a little bit, thinking, okay, well, this might not be, because she said it was the same thing this time. It was just, some fatty deposits and things like that showed up strangely on the, but they had them double checked and checked out and all that kind of good stuff. But she was like, she said, I didn't even remember that. She said, how did you remember that? I said, well, because it was scary to me the first time when you told me about it. And, this time it was a little less scary just because I knew you'd been through it before. And she didn't remember it, but I did for whatever reason.
Well, I've been in Joplin for about 4.5 years. And when I first came here, the date always came around the tornado, 2011, because that's a date that was very traumatic to the community, and everybody remembers that. But that was what was used as the time. It's like, well, it wasn't too long ago I had it in a tornado. And then now I'm saying, well, that's 7 years ago.
7 years ago.
Oh,
yeah.
that's right. And that's the importance, is that no one has time for a mammogram. No one has time for a doctor's appointment. And I understand all that. But for our own health, it's just really, really important, and it could save your life.
Well, and again, I think that just needs to be the message out, to all of our viewers is, again, if you're 40 and you haven't had your mammogram, well, then you should.
That's right.
And, again, some of those buddy check systems and all that kind of stuff. I mean, everybody needs to be doing, self-exams and to doing that. So in the realm of those things, what else can our viewers do to help support each other to make sure that they're trying to stay healthy?
Well, I would say go as a group. 3 or 4 of your friends, go schedule a mammogram, so when you're up there waiting at the hospital, you can turn it into a fun event. And then after you get done, go have dinner, go have a lunch, and say, yeah, I got my mammogram done, and go celebrate a little bit, just to try to make it a fun time, instead of thinking, oh my gosh, I got to go do that, and they're going to do what to me, kind of thinking. But it's self-awareness. As men, women, everybody should know their own bodies, and I'm not saying you have to give yourself a clinical exam, but just when you're in a shower and everything, just to get to know yourself, because if that lump is changing, or you're like, whoa, I've never noticed that before, that's a time you should see your doctor and make sure that your mammograms and everything are up to date.
Yeah. I mean, I get a course myself of, switching doctors and things like that. So again, all those things that have all through the years has said, no, that we don't think it's a problem, no, that we think it's a problem, that's a problem. I mean, I'm like, okay, so here's the list.
That's right.
Here's this unusual thing. Here's this unusual. I'm just going to bring them all up and say, okay, now that we're getting a fresh look, let's start again. Because again, I do think it's important that somebody else, I don't have like a spouse or anybody to help me, check those things or to see if there's a spot on my back or, any of those things. I'm reminded of one of my great aunts who, she had melanoma and they didn't know it for a long time because,
no one looked at it.
No one had looked at it. No one had looked at the middle of her back and saw that it was there. So it was like, okay, So it's always good to have those. I think screenings are good things. Screenings are things that help us. I mean, lucky, to work on a college campus, for many years. That whenever they do health screenings on the campus, I just go ahead and get in line and do my thing, and that's how some of the things that I've come to deal with in life got found was because of those screenings.
Well, and on the college campuses, since you brought it up, is that something we don't really do is we don't talk about breast screening because those young ladies are in their 20s, but it's still a good time to start.
Right.
Of saying, at this age, because some of those women, if they have a high-risk family history or genetically positive that predisposes you to breast cancer, we do recommend at age 25. And so it's never too early to start talking about prevention and screening.
Yeah, and I do think, again, I think that, for us to get that message out to all of our kids, even if they're younger, once they start becoming aware of some of those things, that's also those things to say to parents and grandparents and things like that. So if any of our younger folks are watching, mom, your moms, your grandmas, or those people will sometimes, don't want to go to the doctor, don't want to take care of themselves. They're the last ones that have always, do that stuff. Ask those questions about whether or not. Yeah,
and the older population, even including my grandparents, they don't really talk about their medical history. That's very important. I can't tell you how many times I've talked, well, what about your, well, we don't really discuss that. Should discuss that. If you have diabetes in your family, you have breast cancer in your family, you have ovarian cancer in your family, you have thyroid cancer. It goes on and on. It's important to know your family and because that does play a role in your health care. And it's good to discuss that with your family to know what everybody has and discuss it and be very open about it.
Yeah.
It's not a secret.
Well, I don't think, especially in a family, I don't think those secrets do us any good because I've had to have those discussions in my family. I want to know what other folks in the family have had problems with.
Yeah.
Because there are some genetic predispositions toward things that I think we all ought to know about ourselves and about our families, so that we can help keep an eye on it.
Well, I'm the youngest son. And my mom and dad still think they need to shield me from things. And so when my mom was going through her own breast cancer, she didn't want to tell me. I'm a physician. I do breast cancer, what I do for a living, but my mom still thinks that I'm the goofy kid playing baseball out in the yard. I'm throwing the ball on the roof, and they wish I would quit that. But they don't see me as a surgeon, especially taking care of the same condition that my mom had, and they felt like they need to shield me. And a lot of parents feel that way. They want to shield their kid no matter how old they are. But it's important to have those in-depth discussions.
Yeah. And I do think that that'd be another thing we ought to encourage all of our viewers to do is to be talking about, kind of their family history with their family.
Yes.
You may not want to share it with the whole world, but certainly to share it with your family is probably a good thing.
That's right.
In that regard. Anything else we need to do to encourage our listeners to just kind of, things that they might think about doing or to watch?
Well, I encourage all the viewers to, I'm biased because I do work with Mercy, and I'm the medical director of the breast center, and I have a lot of interest in that disease, and I think our breast center is excellent. We've proved that with the gold standard of getting a centers of excellence, and I do encourage folks, if they are needing a breast screening, to come and get their breast screening done. I would prefer them to come to Mercy, but if they go to Freeman, I understand that too.
Sure.
But as long as they get it done somewhere,
right.
That's the most important thing, and that's kind of what I encourage. And also talking to their primary doctor about when is it time for me to be screened. If they have any questions, I'm easy to find at Mercy. I'm in Suite 440, and they can call my office anytime, and I'm more than happy to talk to them on the phone or do the My Mercy thing or whatever they need for education.
Well, good. I do think that that's one of those things of of how we can help each other as a community to really, in so many ways, to take care of each other.
Absolutely.
And that is to encourage each other to have those tests when you get to those certain age ranges, to go in for that, this screening and that screening and the other screening, and I know it's been a comfort to me, knowing that, okay, so, somebody in my family had, polyps, at a young age. So I was trying to make sure that I got in for mine, to make sure that I didn't have any polyps growing, those kinds of things. I just think we got to continue to have those conversations with each other and help, in terms of how do we, watch out for each other. I think it's really important. So this is Faith in Our Hometown. We're going to be right back after this Mercy Minute to wrap things up. But again, my guest this week, Dr. Kenneth Watts from Mercy, talking about cancer screenings and health.
When they discovered there was no hospital, the Sisters of Mercy built one, as they had so many times before, offering healing and hope on the edge of the frontier. Mercy continues to answer the same call to bring care wherever you or your child need it most. Mercy, in every era, your life is our life's work. Learn why we serve at mercy.net/legacy. Everyone on board dreamed of a new life in America. The Sisters of Mercy had a different dream: to serve all who had need. From the first hospital Sister Frances Ward built to the world's first virtual care center, we continue to answer the same call: to bring mercy home to you. Mercy, in every era, your life is our life's work. Learn why we serve at mercy.net/legacy.
Well, again, thanks for joining us this morning for another Sunday morning on Faith in Our Hometown. One of the things that we know as a community and here in our hometown is that there are certain issues that seem to keep popping up over and over and over again that we need to learn how to pay attention to, and that we as a community need to focus on if we're going to be a more healthy community. One of those things that we've been talking about this morning was cancer awareness, and especially in terms of breast cancer, and how do we help our sisters here in our area to make sure that they're staying healthy in that regard. So we got to continue to encourage people to be screened. We got to encourage people to continue to have their mammograms, continue to people to try to, especially those who are resistant, saying, oh, there's nothing wrong with me, there's nothing wrong with me. Early screening is going to help, and we need to make sure that we're there for all of our sisters who are going to continue to fight this. If 1 in 8 gets cancer, we need to be caring about them. So join us next week for Faith in Our Hometown. We hope you have a great rest of your Sunday.
Thanks for watching. Faith in Our Hometown can be seen Sunday mornings at 6:30 and 9 a.m. on KSN. Brought to you as a community service and sponsored by Mercy Hospital, Joplin.